Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today we are going to talk about Parkinson's disease, a chronic, progressive neurological disorder that affects movement, leading to symptoms like tremors, rigidity, and bradykinesia, slowed movements. This video explores the causes, symptoms, diagnosis, and treatment options for Parkinson's disease, providing a comprehensive understanding of this complex condition. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. Parkinson's disease, PD, is a neurological condition that impairs movement and is chronic and progressive. Dr. James Parkinson initially discussed it in his 1817 essay, An Essay on the Shaking Palsy. Though early onset Parkinson's can strike younger people, the disease primarily affects those over 60. Given its substantial impact on quality of life and the growing number of diagnoses as the population ages, understanding Parkinson's disease is essential. Causes and risk factors. Although the precise origin of Parkinson's disease is still unknown, a mix of environmental and genetic factors is thought to be responsible. The following are some salient points. 1. Genetic factors. Approximately 15% of Parkinson's patients have a family history of the condition. Although they are not the only cause, some genetic alterations have been linked to Parkinson's disease. There are several genes associated with the illness, including SNCA, PARK7, PINK1, and LRRK2. 2. Environmental factors. It has been proposed that exposure to chemicals, such as pesticides and herbicides, may provide a risk. Living in a rural area, using well water, and being exposed to heavy metals have also been linked to a higher chance of Parkinson's disease. 3. Age and gender. The most important risk factor is age, as the incidence of Parkinson's disease rises with age. Though the exact causes of this gender disparity in Parkinson's disease incidence are unknown, men are more likely than women to develop the disease. Pathophysiology. The brain area known as the substantia nigra is the main target of Parkinson's disease. This region generates dopamine, a neurotransmitter that is vital for controlling movement. Dopamine levels fall as a result of the degeneration and death of these neurons in Parkinson's disease. The disease's motor symptoms are brought on by a dopamine deficit that throws off the neurotransmitter balance. Symptoms. There are two types of Parkinson's disease symptoms: motor and non-motor. The easiest to identify symptoms are motor ones, which consist of 1. Tremor, usually originating in one of the limbs, usually the hand or fingers. The tremor is most evident when at rest and becomes less noticeable when moving with intent. 2. Bradykinesia, a defining feature of Parkinson's disease is slowness of movement. It can complicate and lengthen ordinary activities. 3. Rigidity. Any portion of the body can experience muscle stiffness and resistance to movement, which frequently results in discomfort and a restricted range of motion. 4. Postural instability. As the condition progresses, balance issues and a propensity to fall are frequent. Non-motor symptoms, which can be just as crippling, consist of 1. Cognitive changes. These can include everything from moderate memory issues to advanced dementia. 2. Mood disorders. People with Parkinson's disease frequently experience anxiety and depression. 3. Sleep disorders. REM sleep behavior disorder, insomnia, and restless leg syndrome are common in Parkinson's patients. 4. Autonomic dysfunction. Symptoms can include blood pressure swings, constipation, and urine issues. Diagnosis. Parkinson's disease is mostly diagnosed clinically using a neurological examination and medical history. While there isn't a single test for Parkinson's disease, imaging procedures like MRIs and DET scans can help rule out other illnesses. The severity and course of symptoms are frequently evaluated using the Unified Parkinson's Disease Rating Scale, UPDRS. Treatment. Although Parkinson's disease cannot be cured, there are treatments that can help control symptoms and enhance quality of life. 1. Medication. Levodopa, which the brain transforms into dopamine, is the cornerstone of treatment. Additional drugs include COMT inhibitors, MAOB inhibitors, and dopamine agonists, each has a distinct function in treating a particular set of symptoms. 2. Surgical options. Patients who do not react well to medicine may consider deep brain stimulation, DBS, as a surgical option. To control aberrant electrical impulses, electrodes are implanted in particular brain regions. 3. Physical therapy. Both physical therapy and exercise can support the preservation of general function, balance, and mobility. People with Parkinson's disease have been demonstrated to benefit from Tai Chi, yoga, and dancing. 4. Lifestyle modifications. People with Parkinson's disease can greatly benefit from a balanced diet, frequent exercise, and stress reduction strategies. Living with Parkinson's disease. There are many difficulties associated with having Parkinson's disease, but with appropriate care, people can continue to lead fulfilling lives. Here are some useful advice for caregivers and people with Parkinson's disease. 1. Frequent exercise. Exercise is essential to preserving flexibility and range of motion. Customized exercise regimens for people with Parkinson's disease can enhance physical function in general, strength, and balance. 2. Nutrition. Eating a well-balanced diet can help control symptoms and enhance overall health. One typical PD problem that high-fiber meals can help with is constipation. Foods high in antioxidants may also improve brain function. 3. Medication management. It's critical to take prescribed drugs as directed and to control any negative effects. Ensuring that treatment regimens are optimized is ensured by routine follow-ups with healthcare specialists. 4. Support systems. Becoming a member of a support group can offer both practical guidance and emotional support. Support groups help caregivers by allowing them to exchange stories and coping mechanisms. 5. Cognitive and emotional health. Managing mood disorders and cognitive alterations can be facilitated by participating in mentally challenging activities and getting mental health care. Research and future directions. Numerous studies are being conducted to better understand the underlying causes of Parkinson's disease and create new treatments. Among the promising fields are 1. Gene therapy. Scientists are looking into ways to change PD-related genes in order to stop or halt the disease's progression. 2. Neuroprotective agents. Researchers are looking into medications that may be able to stop neurons from deteriorating. 3. Stem cell therapy. Research on stem cells seeks to replace damaged neurons and increase the production of dopamine. 4. Biomarkers. One major area of focus is finding biomarkers for early diagnosis and monitoring the course of disease. Innovative approaches in research. 1. Genetic research. New insights into the inherited components of Parkinson's disease are being provided by genetic research advances. Scientists want to create targeted medicines that can change these genes or their effects by comprehending the genetic alterations that cause Parkinson's disease. 2. Precision medicine. This method customizes a patient's care according to their lifestyle, environment, and genetic makeup. Minimize adverse effects and maximize treatment outcomes are the goals of precision medicine. 3. Neuroimaging. With Parkinson's disease, sophisticated imaging methods are shedding light on the anatomy and physiology of the brain. These tools support early diagnosis, disease progression monitoring, and therapy efficacy assessment. 4. Microbiome research. New data points to a potential connection between Parkinson's disease and gut health, namely the microbiome. Novel therapeutic approaches may result from an understanding of this relationship. 5. Wearable technology. Devices that track symptoms in real time are being developed, and the data they provide will be able to be used to better control symptoms and tailor treatment. Millions of individuals worldwide are impacted by the complicated and difficult ailment known as Parkinson's disease. Although there isn't a cure at the moment, improvements in management and treatment methods may lead to a cure in the future. A thorough treatment plan, early diagnosis, and increased awareness can greatly enhance the quality of life for PD patients. Combating this crippling sickness requires understanding the disease, advocating for individuals afflicted, and funding current research. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.